All right, welcome back to Getting to the Root of It. This is a video series that is brought to you by Mental Dental and Colgate, where we talk to different dental professionals in the field to give you a better idea of what you can expect in the world of dentistry after your graduation, or if you are interested in becoming a dentist or academician in the United States, then we can also give you some insight into that with our very, very special guest who we have with us today. I'm pleased to be joined by Dr. Pimenta, and Dr. Luiz Pimenta has a very impressive resume, which I will read out to you, just so you know how special of a guest that he is today. He attended dental school in Brazil, and then he earned a master's in operative dentistry at the University of Sao Paulo and a PhD in restorative dentistry and prosthodontics at the State University of Sao Paulo Dental School, after which he became the youngest full professor at 36 years old at the School of Dentistry in the University of Campinas. Then he became a professor at the University of North Carolina Dental School, and then the dental director of the Craniofacial Center, the first assistant dean for global initiatives, and was the first director and founder of the Advanced Standing Program for International Dentists at the UNC Adams School of Dentistry. Later, he moved to New York, where he became a professor at the Division of Prosthodontics at Columbia's Dental School, and is now the director of the Prosthodontics division there. And if all of that's not impressive enough, he also has 162 published papers in peer-reviewed journals. Dr. Pimenta, thank you so much for joining us today. It's great to have you.
Well, Ryan, thank you for this very good introduction. So I'm happy to be with you here. But I think that the most important in my CV is that you also were my student. So that's part of the process too. So at UNC, we had a good time when you're getting your DDS training there, and was a pleasure to be working with you. And now I'm here to share a little bit of my experience to help the new generation of dentists. I think I'm getting more close to my end of my career. That's the reality. And I think part of my legacy is to prepare the next generation of professionals, not only here in US, but in Brazil and other parts of the world.
Mm-hmm. Well, I think that's such a noble mission to have, and it speaks to the quality of a professor that you were. I have very positive memories of working with you at dental school as well, and I'm glad that I was able to make a little part of that resume for you. So that's and it's great to come full circle to in this context.
Fantastic.
Great. So maybe we can just go through your journey and to
Okay.
where you got to today, and we can start with your career in Brazil.
As I said, thank you for inviting me for this. I think it's a great opportunity to be sharing my experience. I I am from a family where my dad was a dentist. So he was a dentist, graduated in 1948. So it's a long time ago.
Mm.
And I do remember when I came to him and I said that I was planning to apply to the dental school. And I was the youngest in my family. My two siblings are lawyers or in law professionals. And he said, well, are you sure? Because, you need to really be passionate about dentistry to really be a good professional. And I said, no, this is what I want. And he wants to make sure that I was not just making the choice because I was the last option in the family to become a dentist. But I looking back to my early phase, I don't see any better option in my life. So I do what I love, I do what I like, I enjoy doing it. And I still have the same enthusiasm as when I decided to become a dentist, when I graduated, to the point that, at this phase of my career, I got excited to make a move and move to Colombia and start a new journey at Colombia. I like challenges. I like to be exposed to new opportunities. And I still have that passion, and that is what really moves me forward.
Hmm. Yeah, that's fantastic. That's
So when
fantastic.
I started dentistry in the 80s, I graduated at the Federal University of Minas Gerais in Belo Horizonte. I never thought in my life that I would be living out of Brazil. Uh, my original plan was to graduate and then start practicing with my father. But then during my dental school training, I had a wonderful mentor, Professor Wellington Jansen, who was a prosthodontist, and he invited me to be working with him in the early stage of my career. So I worked with him in his practice for about a year and a half. And then I moved to Sao Paulo for my master. And I was always with this curiosity and this desire to do better, to really excel in what I was doing. And when I applied to my master at the University of Sao Paulo in Bauru, um, was really a big plan. And my plan was, okay, I'm going to get my post-grad training and I will return to Belo Horizonte, my hometown, to open my practice and start practicing. During my master, I had another wonderful mentor, Dr. Maria Fidela Navarro, and she introduced me to the research component of dentistry.
Mm.
And in that moment, I decided to have my PhD. And I said, well, I'm going to extend. I need to learn more. And I was always trying to learn more to better understand everything. And my PhD was basically in biomaterials, restorative dentistry, and prosthodontics. Because in Brazil, like in Europe, we have PhDs in clinical fields. It's different from here in the US that most of the PhDs are in basic sciences.
Hmm.
And so that really changed my life when I start doing research and then I start getting involved more with academia. In that point, there was another very good state university. So most of the public schools in Brazil are the best dental schools. They are funded by federal or state government, especially the state of São Paulo. And I applied to a position during my PhD, as I was doing my PhD in Araraquara, the UNESP, University of São Paulo. I applied to a position as a faculty at the University of Campinas. So during the end, towards my end of my PhD, I was also had another mentor, Dr. Jaime Curi, that was at the University of Campinas. He helped me a lot, and I started doing more research with biochemistry, and then my thesis was related to evaluation of secondary caries around restorative procedures using simulation of induced caries. And then I became faculty at the University of Campinas, and in that moment, we created a postgrad program at the University of Campinas. So I was one of the faculty that initiated the programs there. And for that reason, as I start mentoring and having new people coming to work with me, just to give a better idea, when I finished my PhD, I was around 27 years old. And then my first mentee was probably 1 or 2 years older than me. So it was kind of an awkward situation that you have a mentee that is older than you. But I built a very good team working in a lab, building up a lab. I submitted a lot of research proposals asking for grants in a foundation in São Paulo, a FAPESP, and I was granted with financial support for building a lab and start doing research. My mentees start doing collaboration with other universities then around the world. I had mentees going to Spain, to UK, to US, and that start expanding my career, and I start publishing more, to the point that when I got the promotion as a full professor, I was 36, 37 years old. I start reflecting about my career, and I said, maybe I need a 1 year sabbatical. So that 1 year sabbatical was a result that 1 or 2 years before this year sabbatical, I had a chance to meet with Harold Hyman from North Carolina
Mm-hmm.
and Ed Swift, and they invited me to come as a visiting scholar to UNC. And during that time that I got invited and I was deciding whether or not to go, I got married with Silvana, Dr. Barrows, that was also professor at UNC. And she just had returned from NIH for 3 years at NIH here in the US. And I told her, I said, let's just do a 1 year sabbatical. I just need 1 year to just recharge batteries and rethink about my career, in which direction we're going to go. And then we decided to come 1 year to Chapel Hill. So when we landed in Chapel Hill, the first feeling that we got is, okay, where is the city? Because we are coming from São Paulo, and we arrived in a college town, very charming city.
A little different.
Beginning was kind of a shock, but then as we start living in Chapel Hill, we start loving that place, and was a fantastic time. We start working, and we say we because I also work with Steven Offenbacher, Jim Beck, that we're working with Silvana, with Dr. Barrows. And I start working with Ron Strauss, that in that time was the director of the Craniofacial Center. But as I start working with them, then John Williams was the dean of the school, and they offered 2 positions for us to become faculty at UNC. But at the same time, we had our position at the University of Campinas in Brazil, which for someone that understands the career in Brazil, we were tenure full professor at the University of Campinas, and you just decide to quit. That was a huge impact, a huge decision that we had to make. And when we made that decision, we knew that was a decision that we were not coming back. So that was a very tough time to make that decision. Our families were asking, like, what are you guys doing? Because this is unexpected. And then we made that decision. We were very happy. Living in Chapel Hill was a fantastic time. I just have very good memories about Chapel Hill. I'm still a Tar Heels. So when I became an American citizen, my certificate says that I'm from North Carolina. So I am a North Carolinian. So in my certificate, so I'm an American from North Carolina. But anyway, so during that time, John Williams made that offer. We decided to stay. And 6 months after I was working with Ron Strauss as the director of the center, Dr. Strauss was invited to be executive provost of the university. And he came to me with Dr. Drake, that was the medical director of the Craniofacial Center, and they said, you know, Luiz, I think you are the perfect person to become the director of the Craniofacial Center, the dental director. And I just had 6 months of my position as faculty there. I said, okay. And he said that in that time, and Ron Strauss was a great mentor in my career. And he said, I'll be around. You know, you have my phone. If you have any questions, just call me, talk to me. I'll be here. And actually, he was very supportive throughout my entire tenure at UNC. So it's a good friend, dear friend. And so I stayed just jumping. Otherwise, we're going to be here the entire night talking about this, but just jumping the time. So I spent from 2006 to 2021. So 15 years as faculty and 13 years as the director 14 years as the director of the Craniofacial Center. And during that time, around 2015 or 2016, there was a new dean, and then the new position as the assistant dean for global initiatives, because during this time that I was working with Ron Strauss was also the officer for international relationships at UNC, and I was representing the dental school throughout this time, helping the students traveling abroad in different trips with different contexts of trips, like going for research collaboration, for service, for a learning experience, exchange of students, hosting students from Singapore, hosting students from Moldova. So I was very active involved in that, and that naturally came as a invitation to be the first dean, assistant dean for global initiatives. And when I accepted that, my vision and my proposal was, okay, my intention is to create an advanced standing program for the University of North Carolina. I can be the dean as long as you give me the support to try to implement the advanced standing program at the University of North Carolina, which for people that will be seeing this interview, advanced standing programs in the United States is to prepare international dentists trained abroad to be able to practice dentistry in the United States. And as a international dentist trained abroad, with the opportunity that I had to come, and for me was kind of a natural path, because I didn't have to do all those things because I was already coming through academia. And I just start working with CODA, trying to prepare all the documentation, and with the support of the entire community, the faculty, the students, the provost, the entire administration of UNC gave me a lot of support, and we were able to create and implement the program for the advanced standing program. I think just going back a little bit, when I was still in Brazil, because I think this is important, because when I was at the University of Campinas, I had my private practice at the same time. So I was teaching and giving, doing research throughout the day, but I still have my practice with other faculty. So we had a clinic, and that was another very difficult moment to, when I said, I'm going to move to the United States, I had to sell my share on that practice and find someone that would buy and would be accepted by the others. So, there was a very complex process to make this decision. But I think looking back, I don't regret. I think made me a better person, a better professional, with a more resilience in terms of understanding differences, diversity. Because when you move to another country, and we since we arrived, we were always well treated. We never felt any discrimination in any level. But even there are some differences in culture, to the point that when I start as a faculty at UNC, I was already a professor. I already had my career. I was an experienced clinician, researcher. But, in reality, the first 3-4 years, I was behaving like a junior faculty, because I did not understand the rules, the political environment, how interact with staff, with students, with the faculty, with the peers. So it takes a while for you to really learn. And one thing that I would recommend for any international professional moving to another country don't try to change the culture because you're not going to be able to. You have to adapt to that culture, and you
Mm.
have to accommodate, to be resilient enough to understand that there are differences in culture. And if you decide to live in that culture, you have to adapt. You have to really incorporate part of that culture, and then you're going to be able to succeed. Because if you're going to start always comparing and say, oh, in my country was different, in my country, yes, it is different, but so what? So you really have to adapt, to really understand and say, okay, I can navigate in this water this way. It's a little different, but I can still navigate.
Hmm. Wow. So many.
So
Yeah.
yeah, there's a lot of nuances and challenges in this process. So then in 2021, I think I look at everything that was achieved and done at the University of North Carolina. Silvana got an offer to join a corporate, like changing from academia to corporate, which is another huge challenge. I think for her is really a big challenge because she's a researcher with a strong career in research, and to move to corporate life is relatively different. And for me, it was relatively easier this transition because I was moving from North Carolina, which is a top dental school in the country and in the world, to Columbia University, which is a top university in the world too.
Hmm.
So I feel very comfortable with my transition as I moved to New York. Of course, the lifestyle is different, but I was coming from São Paulo, so it's always going back to where I was in the past, a big town. So getting adapted to New York was relatively uh, okay, no major challenges. Of course, distances and time for going to work is a little different, but those are minor things that we have to adjust. And here in at Columbia, I have wonderful colleagues. Like the environment is very friendly, very nice. Of course, it's a elite school, so you look around, all the faculty here, they are very well accomplished, and you have to be working to make sure that you're also making your presence uh, justified. Like, okay, you're here and you have to contribute, you have to really be productive. um,
Hmm.
my move to New York and to Columbia was fantastic because my negotiation was basically via Zoom because it was in the middle of the pandemic. I had the privilege to really interact with Dean Stoller. Dean Christian Stoller is a fantastic dean, a very good human being with an excellent vision about dentistry, uh, accomplished professional. And then Panos Papapano, who is the chair of the section here where I work with, it's also a very well-known periodontologist in the world. So being surrounded by good people is always good. Like they motivate you to keep moving forward. And now we have a new program director in our program, Dr. James Wu, that came from Birmingham, that I was able to recruit him to join prosthodontics. So we are really restructuring the entire division of prosthodontics. We have Dr. Nick Allen collaborating with us, Dr. Tarnow, uh, it's a next door. So when you see those names and you see these people working here near you, it's really something that is really motivational.
Hmm. That's wonderful. Well, thank you for sharing all of that. There's so many good things in there that I want to kind of pick out just a little bit for the listeners to recap some things that you shared. First of all, in the early parts of your story, I sensed some common threads that you had one of which was the supportive mentors. So it sounded like almost every step you had at least one person who really kind of helped you find your next step and cemented that for you in terms of pursuing that restorative dentistry career, pursuing the research focus. And that research focus really led to you building that early resume and then having those connections that eventually led you to Chapel Hill.
Yes.
So that's really great. And then I feel like also you just had this innate hunger for knowledge and for learning more, and that really drove a lot of your, I think, decisions to get more involved with research and to give back to students through a faculty position. And so those are some of the threads that I sensed with your story early on.
Well, let me just say this. I don't see anyone that could be successful in in the academic career, but I would say even further, that could be successful in any career in life without mentors.
Mm-hmm.
Like a mentor is not someone that is going to tell you what to do. A mentor is going to be someone that is going to share their experiences openly and with confidence to at least allowing you to reflect and to really uh, it's almost like a psychotherapy. Like when you
Mm.
talk to someone with more experience, they can share their mistakes, they can share their successes, they can give you some advice, but at the end of the day, you will make your own decision.
Right.
And I would say this because all my mentors, they were fantastic team builders. Like they really built teams working with them. If you want to go fast, go by yourself.
Mm.
But if you want to go further, you have to build a team.
Mm.
If you want to have a long career, a successful career, a productive career, you're not going to make it by yourself. And if you look at publications, you start your career as a first author because you are the one doing the
Right.
work, because you have mentors mentoring you. At the end of your career, you're going to be the last author.
Mm-hmm.
You're going to be the PI, someone that is guiding a team to really come up with new knowledge. So that's how an academic career, in my perception, is built. You have to always be part of a team as the beginner or as a team player at some level
Mm-hmm.
or as the mentor. So
Mm.
I can see clearly that in my path, in my life, because early in my career, I was sleeping in a lab doing research because I had studies that I had to go and check the samples and doing things like that. To the point that later I was meeting with everybody every week, all my mentees, and discussing doing brainstorm and discussing methodologies and things like that. And now I'm more leaning towards the administration that I have the entire division that I need to have a vision that how we're going to develop or continue working with the pre-doctoral education, how we're going to increase the capacity or improve the quality of our post-grad program, how we're going to serve better the community where we work, well, how we're going to provide care to the community around the Presbyterian Hospital in New York, because that's the population that we see coming to the hospital, coming to the dental clinics. How we're going to provide support to our residents for them to participate in programs in professional meetings. They will present posters, they will have oral presentations, what kind of research they will be doing, what kind of clinical work they will be doing. Like right now, we're looking at the possibility to bring a device for guided navigation surgery for implant placement for our prosthodontic residents. That's going to serve not only to our residents in pros, but also perio, endo, oral surgery. So that is my role now as a director of the division, is to really create opportunities for the other faculty, for the other residents, the staff, to really do their best. So my position now is to create a good environment for work, that people will feel pleased to come and work. Because early in my career, I had another mentor that always said to me, when we come to work, we come to work for living, not for dying. So you need to make a living. You don't need to die on your work. So you cannot
Right.
come and suffer. So you have to feel pleased. You have to really feel happy when you come to work. So that's my vision. That's how I see how we can create a good environment for the people that are coming, younger people or people that are in the middle of their career, to have a good environment for them to continue working, to do their best. And as a team, we're going to achieve better results. Basically, that's it.
Mm-hmm. Yeah, that's wonderful. As you were talking, I was thinking about this. I feel like you can almost put, and I say this as a way to motivate any of you dental students out there right now. I feel like you can kind of put students in two camps. One is, I go to school to get through it, or I go to school to see what I can get out of it.
Yeah.
And what I mean by that is, I feel like a mentor, most of the time, unless you're very, very lucky, a mentor is not going to just fall on your lap. You know, if you're just going to school to get through the next exam, get the grades, and then get out of there, you're not really going to find those opportunities that you did. But if you walk around with eyes wide open, you take advantage of office hours, and you make connections and insert yourself as part of teams in the research context and other contexts, like that's when you're really going to start to see the doors open for you. And I think if you can be that sort of student, that's when the doors will really open for you in that.
I can give you one. As you were describing this, came to my mind a clear example. I had a mentee, well, while I was in Brazil. She was a dental student at the University of Campinas. And I remember the first time she knocked on my door, that very young girl, because in Brazil, we go to the dental school. When we start, we are 17 years old because we don't have the college.
Right.
So I remember her coming, and I hope that she will see this interview because she's going to remember. She knocked on my door and she said, Dr. Pimenta, I would like to work with you. I know that you're doing research, and I love doing research because that was part of my plan when I came to dental school, especially at the University of Campinas. And I remember that when she came to ask me that, I was extremely busy. Like, I had lots of mentees. And I said, well, what can I do? Because I don't want to say no to someone coming and asking me this.
Sure.
So, and then I said, do you have a topic? Do you want any topic that you want to work with? And she said in that time, maybe tooth whitening or something like that. I said, okay, so let's do this. Do you know PubMed? And she said, yes. I said, okay, go to PubMed. I gave a task to her, like a very boring task, which is go to PubMed, read the abstracts, select some papers, bring them to me. I will look, and then you come up with any idea about what you want to do in terms of research on tooth whitening, and then we'll talk. 2 weeks passed. She came to me with a folder, extremely well organized,
Love
with
it.
all the abstracts printed, highlighted, everything extremely organized. And she said, this is what I would like to do. I could not say no to her.
Yeah.
So then I said, okay, let's write a protocol and submit a grant to FAPESP, to the foundation. because in that time, FAPESP, they had like a fellowship giving some support for dental students initiating on research. So she wrote the protocol with my help. I refined everything. I submitted. She got the fellowship. So then she started doing
Wow.
research with me as a dental student. So she came and she applied to the master under my mentorship. And in that time was a very competitive process. And she got accepted to the master program. But I was so busy with so many mentees that I came to a colleague, another faculty, and I said, "Can you be officially her mentor? And I will be the co-mentor. We're gonna work together." So building teams again,
Right.
like
Yep.
we have a team. Say you can, and she was a relatively junior faculty that I was mentoring, and I said that's a good opportunity for you to start learning how to mentor. I will be here mentoring you how to mentor her, and we're going to work together. And we did that to the point that she finished her master. This young student finished her master, and she said, "Dr. Pimenta, I would love to work with laser." That was probably 20 plus years ago.
Wow. Yeah.
And I had a good connection with one of the pioneers in laser in dentistry in Brazil at the University of São Paulo. And I said, let's do this. On your thesis defense, I'm going to invite that faculty to come and be part of the committee. And then I'll talk to him and see if you can do your PhD at the University of São Paulo. So she presented her thesis. He came for the thesis for the committee. I spoke to him and he said, okay, I will mentor her at the University of São Paulo. So she left. So I gave up because she was ready to go to a PhD. I said,
Ready to fly.
this is your journey. You go. Today, she is the person responsible for laser at the University of São Paulo.
Wow. That is incredible.
Ana Cecilia was my student, and I feel proud because I follow her on Instagram. I see her talks and her courses that she's presenting in Brazil, and she's the person responsible for a lot of the development of laser in Brazil, and she's an expert in laser
Wow.
in Brazil.
Incredible.
Maybe I'm going to invite her now to give a talk to Columbia here to our students here at Columbia, because
Yeah.
she is a
Yeah.
really expert in laser.
You should. That's an incredible
So
story.
that's an example of how I truly believe that mentorship and working as a team is a key component for the success.
Mm-hmm.
And today, as I see many of the people who work with me taking the lead, becoming successful professionals, leaders in their fields, it's really my realization. Like, I know that that's my legacy. I know that at some point when they're giving lectures or giving an interview like that, they will mention my name and they say, well, I had a mentor, the same way that I mentioned my mentors here. And
Mm-hmm.
that's how we perpetuate our presence in this planet.
Yeah. Yeah. Beautiful. And it all started with a knock on the door.
Knock on the door, going back to
Young.
your question, and I could not agree more with your perspective that, a mentor will not come to you offering you to be mentor.
Mm-hmm.
But I agree with you that most of the faculty and more the senior ones, they are extremely happy when we have young professionals coming to our doors, truly and honestly asking for mentorship. I never would say no to someone that come openly, truly, and honestly saying, I want to learn more. I want to be better. And can you guide me? How can I become a better professional? that's what really it's a fuel for my journey in
Yeah,
this career. Yes.
right. And you can't force it, but like you said, if you're genuine about it, honest about it in approaching a faculty like that,
It's
that's
really, and it's a joy. Like when you see someone really progressing and becoming an expert based on something that you just help, like you just guide. Because they, a mentor also is not someone that is going to do anything for you. They will guide you, but you have to work. You have to do it.
Mhm.
Otherwise, it's not a mentorship.
Yes. Yeah, right, right. Then it's just a
Yeah.
lecture. Yeah.
Yeah.
And that's
So as a
different.
mentor, you cannot expect that your mentor, your PI will do the work for you.
Hmm.
You have to do the work. They will be there to facilitate, to give you different thoughts, open your mind for different perspectives, different experiences, and then you will do the work.
Hmm. Exactly. Moral of the story is be the student who knocks on the door, not the student who just walks in the door and out the door every day and
No,
misses the
because yes,
opportunities.
and at this level, we are all adults, we are all professionals. If you ask me, like, would you take attendance for your lectures? No. I'm there openly teaching and giving 100% of my knowledge to the ones that wants to learn. For the others, if they want to just pass by, that's fine. It's it's their profession, their careers,
Hmm.
and we are all in a professional school. This is something that
Right.
I always tell from the first year of a dental student. You are in a professional school. You are being evaluated as a professional since day one.
Hmm.
If you're cheating, if you're cheating close to your peers, surrounded by your peers, what are you going to do when you're going to be in your private office? So
Exactly.
I would not refer one patient to a colleague that I know that during the dental school was cheating
Right. Yep.
because I know that that person is cheating. So if they were cheating publicly, what they can do privately.
Exactly. Exactly. Because
So
that's
that
consistent. A lack of integrity doesn't just stop at school. I mean, that will
yes,
follow that person
yes.
into their
So
profession. I
if
agree.
you're honest and you have integrity, you're gonna do it always.
Exactly. Well, this is great. And I know, Dr. Pimenta, there is great interest on my YouTube channel for a guest to provide insight and guidance regarding foreign trained dentists and graduates wishing to enter academia in the United States. So you are quite literally the perfect person to interview, being the founder of an advanced standing program, and
Uh-huh.
so much great advice. And for the challenge that you mentioned about integrating into a new culture. I know that's one of the common questions, interview questions that foreign trained dentists are asked is what do you anticipate is the biggest challenge that you'll face entering this program if we select you? And I think that's certainly from the sounds of it, one of them.
Okay. Well, Ryan, I think we already touched on all these aspects, but being
Yeah.
very objective to the advanced standing program. I have a passion for this because I think we have so many excellent professionals trained abroad that for any reason they sometimes are even forced to move to United States. I have interviewed people that literally they were forced to move out of their countries.
Hmm.
And some of others, they are not forced, but there are not many options in terms of having a decent life in their countries. But they are well trained, they are good professionals, good people, and they are coming to a country to try to live and have a decent life and they already have a profession, but they cannot practice that profession,
Mm.
or reasons that are different in all aspects, different training, different language, different format of dental education. But at the end of the day, they are all trained to be a dentist, and they have qualifications to have that profession. But the advanced standing program is a type of program that really standardizes and gives the opportunity, or give the chance to have equal opportunity to succeed once you pass through the process. And that was my rationale when I, with the help of the entire faculty and the community, my initial proposal for the advanced standing program at UNC was not to have a separate advanced standing program as part of the dental school, but to really have the advanced standing program, or the dental students through the advanced standing program, to integrate to our curriculum at UNC.
Mm.
The way that we set up in 29 months. So from January to June, they would have some courses with the second years, the DDS2, some specific courses that were designed for them to integrate, like pharmacology. Because one of the huge challenges for me when I came was pharmacology,
Mm.
because the drugs were different. So
Yeah. Yeah.
the way that you prescribe is different. The rules are different, how to prescribe. When I got to United States, opioids were the state of the art for pain control. Now we know how bad that is.
Right.
At that time, when I came, I said, I never prescribe opioid for managing pain. Why do I have to prescribe?
Mm.
And that was a shock for me.
Right. Right. Great
When that
point.
I, even as an experienced clinician, I start thinking, should I be, learning more about opioids? Should I prescribe opioids? Because I never needed to prescribe opioids for managing oral facial pain for my patients. Anyway, so this is just a
Yeah.
parenthesis, this story, but this is one example. So when I designed, or we designed the program at University of North Carolina, we had this 6 months of integration. And once the selected students successfully complete these 6 months, they would join the DDS3. And then they would become part of the class
Mm.
of DDS3. And then when they graduate, they will not be called separate from the entire class. They will be already integrated, because they will do DDS3 and DDS4 with that class. They will be able to be part of our community. They will be feeling integrated. And that was the way that I created that program. Because in other schools, for any reasons, and I don't want to judge, but they have sometimes separate
Separate.
programs.
Right. Right.
And I personally don't like, I'm not judging. If they are successful, that's great. But the way that I had the vision for the program was to be an integrated program that would allow the international dentists to be integrated to the class. And then they will have a diploma that is exactly like yours.
Mm-hmm.
They graduated, they passed the same tests, they attended the same classes, they attended the same clinics, they were evaluated the same way. So they are truly and
Right.
honestly UNC dental students.
Mm-hmm.
So basically, that's how I developed the program. And so now, what are the challenges from an international dentist coming? First of all, the challenges of getting a visa and being accepted in the country.
Mm.
Unfortunately, from some countries, they have different levels of scrutiny. to get a visa. But let's say once they get the visa, they come. My first advice is take the boards. So study by yourself, take the boards, pass the boards. Once you pass the boards, you're going to at least give to whoever is selecting that you're capable of taking those exams and pass, because you have language barriers, cultural barriers. And that's the reason that you see a lot of people from India in those advanced standing programs, because they are trained in English. So for them to take the boards, it's natural. It's different from someone that comes from Brazil who speaks Portuguese. So you have even if you speak English well, it's still your second language. So you're not educated in dentistry in Brazil in English. You're educated in Portuguese. India, you have your dental training in English. So that's more natural. You see the difference? So that's the reason when we start looking, the demographics of the people taking the advanced standing programs and doing the standing programs, you see that language barrier is kind of a filter because communication is extremely important.
Right.
So the second thing is try to identify the region where you want to work. Like if you want to come to Northeast, so you need to look at the schools in the Northeast area. If you're more leaning towards the southern part of the US, you have to look at North Carolina, South Carolina, Florida, or if you want to go to the West Coast, California, Oregon, Washington. So you have to look where you want to be. Texas is another place. US has this privilege to have well-structured centers throughout the entire country. If you go to the Middle East, you're going to find. If you go to the South, you're going to find places. If you're going to go to the Northeast, you're going to find places. If you go to the West Coast, you're going to find places. So the programs in the US, they are all standardized because CODA requires the standardization. So you're supervised and controlled by CODA standards. So we have to have CODA standards for all the schools. And this is extremely. So those are my main advice. And try to find someone that can mentor you. Talk to the people that are going through the program and get some information about it. You need to see what is the culture of that school where you're planning to apply, to see if you're going to feel welcome in that area, in that environment. And this is something that is very particular. So each person needs to really, don't try to just say, oh, I'm going to go to advanced standing program and I'm going to try 20 programs, in one accepting me, I'm going to go. Because maybe sometimes that's not a program that you're going to be happy. Another thing during interview, don't try to make up on your interview. Yourself.
Yes.
Tell the truth.
Yes.
Tell your expectations. Because if you sell yourself differently, and by any chance you get accepted, you're not going to be able to beat that person for 3 years.
Exactly.
And if you try to be accepted and then you see that that school is not a good fit for you, you're going to have to deal with that school for 3 years.
Right. Goes both ways.
Yes. Don't just be yourself, be honest, ask the questions, and try to really find a place that is going to be a good place for you. That's it.
Exactly. Dr. Pimenta, I know we're getting tight on time. I really appreciate you being here. I just want to, if you don't mind, ask one more question for you.
Sure. No problem.
For the international dentist who wants to become a faculty at a school, do you have any specific, I know your route was a little bit unique, your path was a little unique. Do you have any advice for someone who's in that mindset of wanting to teach at a dental school in the US?
I would say that there are two paths. One is if you are already a well-accomplished faculty in your country with a good track records of publication, mentoring, teaching, you are already an expert, just submit your application, faculty position here. US is very open to accepting international dentists as faculty. Most, if not all, dental schools in US, they really accept and they like to have this diversity of international dentists coming to US. This is one path. The other path is if you really want to get involved in academia in the United States, if you're young, if you're relatively young, like in the beginning of your career, see if you have any chance to get accepted in a graduate program, a specialty program, prosthodontics, endodontics, whatever is your field, orthodontics, and have your training as a specialist. Take the boards, pass the boards, become a board certified specialist in any area. During this time, as you are doing your graduate program, see if you can do a combined PhD post-grad training. If you get that, you're going to be a full package. You're going to be a specialist in a clinical with clinical expertise, board certified with research background. And then if you still have a chance to get maybe any of those trainings from NIH, like T32, or any training for young researchers in translational research, then you're going to be a rising star. That is a path. If you want to be in a excel position to really be able to be attractive, to whenever you apply, people want to recruit you, then in this case is perfect. Another alternative, get your training as a specialist. If you're not into research, but you're a good clinician, you have good skills, get your training as a resident, do your board certification. Then you can go to states that accept you as a clinician without the need of the DDS, the American DDS, because there are some states that accept that. Or instead of doing a PhD, do an advanced standing program right after your graduate training. Then you're going to have your American DDS with a specialist certificate, board certified. You can even become a program director in any PG program. Those are
great,
good paths.
Great. That is very, very helpful. I know people are asking for that advice specifically, so that's really great guidance.
Those are not easy paths. Let me be clear. So you have to really be good. You have to work hard. You have to be dedicated. But if you do that, I can guarantee you that you're going to get a position and you're going to be successful and you're going to be in a good environment that people will want to recruit you.
Great. Fantastic. Well, this was a fantastic episode. I feel like we really covered a lot of information, and this was wonderful to hear your story. And I think there will be a lot of nuggets of wisdom that people will get from this conversation that we had.
Ryan, I think it was a pleasure. I really enjoyed this time with you.
Me too.
I was having a conversation with a friend, telling about my life. Thank you for this opportunity, because allow me to go back in my life and reflect about my life. Sometimes we don't have time to do that. We just keep working and we don't think about the path. But looking back, I feel more motivated to move forward. Let's put it this way. I think I still have a good journey ahead. I enjoy what I do. I love what I do. And I am sure that I can still have a very positive impact in dentistry, not only in the United States, but in the world. And if I have the opportunity to still mentor some young generations, I'm extending my journey even
Hmm.
after my journey. If you know what I mean. Like I
Yes.
know that we have our time. I don't know what time is gonna be, but I know that I can live through my mentees. I can be around because I have positively contributed to their lives.
Hmm.
Of course, I made
Yes.
mistakes in life. Everybody does. But the good thing is that when you look back and said, even if I made some mistakes, they were not intentional. I never did anything intentionally bad to anybody. So I always try to be positive. I always try to contribute. If I made mistakes, I'm sorry, but that's life.
Hmm. Right. Exactly. Well, uh, cheers to a long legacy, Dr. Pimenta. You've definitely, obviously, had a very positive impact on many, including myself. And thank you again so much for your time
Thank
today.
you. Very nice talking to you.